Hi guys, it's Monday morning and it is like monsooning here on the East Coast in Connecticut. Okay, it's the beginning of the week. That is the anniversary of 5 years ago that I was diagnosed with the ovarian, that tumor, the cancer. And now I'm done, as I like to say. So we're going to do a little teaching this week because I have not been teaching these last 2 weeks because there's been a lot of things going on. And I was on call and I owe you the placenta video, which is really fascinating, the placenta. So today we're going to talk briefly, before I walk into my office of charts and craziness, about screening. You may know this. There is no screening for ovarian cancer. You may not know this. There is no screening for ovarian cancer. So please let that sink in, because over and over, when people say to me, how did you find your ovarian cancer? Was it from your Pap smear? Even some of my best friends who were with me through the entire debacle. There was some debacle within my ovarian cancer. They still are like, wait, was it your Pap smear again? No. The answer is no. So let's just do a quick screening test discussion, and then we'll talk about the ovarian cancer and the fact that there is no screening and why there's no screening and what may be on the horizon. So screening tests by definition need to be tests that are done in the setting of a screening, meaning you are not having any symptoms. You are literally just going in just to make sure that you are being checked for something. So the terms that like insurance companies will use is preventative, annual, yearly screening. Okay? By definition, again, that means I'm just walking in, feeling fine. Someone's asking me questions or someone's doing a test, and they're able to pick something up with a test that is relatively easy to perform, easy to interpret, relatively accessible to the masses and cheap. There's actually a very strict definition of screening tests. And that you are using it to find a clinical scenario that has a phase that we can pick up early so that we can actually prevent the more concerning issue, right? Meaning, for example, a mammogram and Pap smear and colonoscopy, they are 3 great screening tools because they are giving us the opportunity to find cancers in the early clinical phases before the cancer has become much more aggressive. And that's what we want. One of my many isms that I say to you guys often is, we are much happier with things that we can find and fix. So if you've ever needed, for example, a test or a biopsy with me, you may have heard me say things like, it's likely going to be normal, but I'm happy when my corollary to it's likely going to be normal is, and if it's not normal, we are catching this early and you're going to be okay. Because that's what we ultimately want, right? As I say to you guys frequently in my office and here, if you're listening, we're not really scared and nervous, if you really think about it, about getting cancer. We're scared and nervous about dying from cancer. Okay? Let that sink in. And I say that because many of us, many of you, not me, because I've been through it, kind of live with this constant anxiety of like, what if I hear the word cancer? And I'm telling you, please don't feel that way, because that word cancer is frequent. That word cancer is common. That word cancer will affect a large percentage of us, especially the longer we live. And if you fill your mind with this notion and this connection of cancer equals death, which is the mindset model that you've been taught through the years, through all the bad PR that happens in America, then you will just trigger the most insane anxiety feeling every single time anyone calls you with an abnormal test. So I would like to dissuade that, because cancer does not always equal death. In fact, the vast majority of people who have cancer do not die. And if you don't believe me, just take a second right now to think of all the people you know in your life. And I bet there are many who have been diagnosed with various forms of cancer who did not die. Now, yes, I know there are people with cancer who did die. I know them myself. And it's deeply sad and distressing, and we need to work harder and do better to prevent the ones that we can. We cannot prevent all of them yet. Maybe in the future we can. So, again, the things that we can find and fix, we should. And let's remind ourselves, cancer does not equal death. Okay? The way we can do better is do our screening tests that are available to us so that we can find those things early. So the screening tests we're going to talk about. Your mammogram. That is the tool that you can use to find breast cancers early. Oh my God, but what if I get breast cancer? Well, here's the truth, ladies, you might, because statistics are there. But if you find it early, you're going to be okay. Now, is it a walk in the park? Hell no. You ask any woman that you know who's gone through breast cancer treatment, even early stage 1, it's not easy. It sucks. But nobody ever said to us that this was going to be easy. As I say, no one promised us a rose garden. Not one of you have had an easy life. I guarantee it. I know. Without knowing you, you haven't had an easy life and you've gotten through it. So screening mammogram for breast cancer. If you are in certain states and they tell you you have dense breasts, then you might do an ultrasound as a screening tool. Certain states will not cover that for the ultrasound. Even in Connecticut, which is considered a state where a screening ultrasound is considered a screening tool, again, meaning it should be covered by insurance. Insurance companies try to not cover it. Okay, so that's screening for mammograms for breast cancer. Pap smear, that is a screening test for cervical cancer. There are times where it might pick up vulvar, vaginal, or uterine cancer, but that is not the purpose of the Pap smear by and large. By and large, it is a screening tool for cervical cancer. Why do we get cervical cancer? We get it from the HPV virus for the most part, not 100%, but the vast majority of cervical cancers are from HPV. Therefore, if you see your doctor at the intervals with which she and you determine you need your Pap smear, because the guidelines are very challenging. We're not going to discuss the guidelines for Pap smears right now, but you start essentially at age 21, and then you'll talk to your doctor about how often you need it, anywhere from every 1 to 5 years. If you get screened for cervical cancer, you will likely, if you have early changes in your cells, you will likely find those abnormal cells and either address them until they go back to normal, because they can do that in cervical dysplasia, we call it, which is abnormal cells that could lead to cancer. Or if they have actually turned into precursors that your doctor is worried about, she will remove them before they've turned into cervical cancer. So cervical cancer in particular offers us a great opportunity to prevent late stage cancer. Many cervical cancers nowadays that are found in patients who haven't had screening at all or the right intervals. Okay, so that's mammogram, Pap smear. Colonoscopy. Colonoscopy guidelines recently changed. The American Cancer Society said start at age 45 because there was a high number of men and women who are having colon cancer earlier, even without family history. So start at age 45. Colonoscopy, oh my God, but it's gross, but it's this. I don't really care, because guess what? Getting colon cancer is more gross. So colonoscopy, they can find a polyp early that may have some cells in it that may lead to cancer. They remove it. They have prevented your colon cancer. These are all easy, very safe, very important screening tools that you all can and should do. Depending on your age, talk to your doctor. There are actually other screening tools that happen every single time you walk into your gynecologist's office, like her checking your blood pressure, like her checking your urine potentially, depending on what age you're at or what risk factors you have. For example, for STIs, or if you've never seen your internist, she might send your urine to make sure there's no microscopic blood in your urine. If you're seeing your internist, which is the same as your regular medical doctor or GP or family practice doctor, that doctor will be sending your urine every year. That's another screening test, because that can actually help rule out kidney cancer. So there are a lot of screening tools that you are having done, whether or not you know it. None of the tests I mentioned talk about ovarian cancer, because ovarian cancer is sneaky. It's not silent. It is not the silent killer. We talked about that back during my birthday anniversary in April. Silent gives us this impression that we have nothing to do. Throw up your hands. You can't prevent it. And the fact is that we don't yet know how to prevent ovarian cancer short of suppressing ovulation with birth control pills, because that does help prevent ovarian cancer and it has been proven. Short of generally healthy lifestyle, which is good for all cancers. But we can try to find it earlier. It's not silent, it's subtle. When you go to your doctor's office for your regular annual exam, your yearly exam, your screening exam, and she does the pelvic exam where she looks at your vulva and then she puts the speculum into your vagina to do your Pap smear, and then she does the bimanual where she puts her hand inside your vagina, 2 fingers usually, pushes on your pelvis. That's for her to make sure she doesn't feel any big mass. The absence of feeling a big mass does not mean you don't have ovarian cancer. And I don't mean that in an inflammatory way. I don't want all of you to be like, oh my God, I had a normal exam and I might still have it. The likelihood is you don't have it. But unfortunately, living under a veil of I just don't have it because I had a normal exam with my gynecologist each year is a misconception that unfortunately is propagated probably by us in lack of education. So I'm here to educate you and tell you, please make sure you know the signs and symptoms. Bloating, pain, pressure that lasts more than 2 weeks is likely not ovarian cancer, but you never know. So you should get it checked out. How do I get it checked out? You go to see your doctor and she will likely do an ultrasound, a pelvic ultrasound. She'll order a pelvic ultrasound. She'll talk to you about a pelvic ultrasound. Now, let's say once you've determined you're having bloating, pain, and pressure, she thinks it's a urinary tract infection and she sends you for a urine culture and you actually have a UTI and you get better, then you don't need the ultrasound. But let's assume you think it's a UTI, you don't actually have a UTI, then you need an ultrasound. So again, generally, bloating, pain, pressure that lasts more than 2 weeks is likely nothing concerning, but it gets blown off routinely over and over by women and doctors, and that is one of the reasons we have a lousy pickup rate with ovarian cancer. And the fact that there is no screening test is because the ovaries are sneaky, they're small, they're deep in your pelvis, and they are hard to find and access. So we have no screening ability. We don't have the opportunity to swab them or to scope them or to do a picture. But why can't I do an ultrasound as a screening test? Great question. Because unlike your breasts, which don't change so frequently, your ovaries actually change day to day throughout the cycle, as you know. And when we do an ultrasound, it's only looking at a snapshot right now. Within 6 weeks of that ultrasound, your ovaries could change. So there's no screening interval that has been found to be able to kind of safely and easily, with sensitivity and specificity, those are the words we use, pick up an ovarian cancer. Plus, an ultrasound is not a quick, easy test like a mammogram. An ultrasound is not readily available to everyone. An ultrasound is not always inexpensive. So these are all reasons why there is yet no screening test. But what about a blood test? Can't they just find a blood test like the way they have one for prostate? Which the prostate test apparently is not so great either, the PSA. And lo and behold, they're looking. There are companies that are looking. In fact, the company that I am now consulting for that I love, that I'll talk more about, is really trying to figure out the algorithm of 7 different biomarkers that may help as an earlier tool. We're not yet at the point where it's a screening tool because ovarian cancer doesn't represent only one cancer. There's different cancers. And again, the ability for those ovarian cancers to secrete enough of these biomarkers into our bloodstream that then can get picked up in a way where we can do a blood test serially and find an objective number above which we have to be alerted is not so easy. You'd think it is, but it's not. So these are all the challenges with ovarian cancer. Does that mean just throw up your hands? No. That means get to know your body, get to know what tests you're doing, get to know why you're doing these tests, and get to know why, when you have symptoms, you should be proactive about them. Should you be paranoid and paralyzed with fear and think that you're dying of ovarian cancer every time you have bloating and pain and pressure for more than 2 weeks? Hell no, because I've said this before. Fear is something we should reserve for when we're being chased by an animal in the wild. Panic, never in the history of ever has panic helped. So don't panic, don't be fearful. But if you kind of live by the, I'm going to be proactive, not paranoid, and it's likely nothing, but I'm going to get it checked out mantras, you will likely be okay. Because if you have something, it will be picked up early. I don't like to say to people, you're likely fine, it's no big deal. Because I don't know it's not a big deal. I've had big deals in my life. I have myself had big deals happen to me with all the physical things I've had done. So I don't want to sugarcoat it. I don't want to be that doctor who's like, no, it's going to be okay. Meaning, it's going to be okay, you're not going to have anything. I live in a world where every single day things happen. But I can calmly say to all of us, if we keep our wits about us and we work together as doctor-patient, then we can find these things early. That is why we're here in modern medicine. That is the purpose of us being here. That is the only reason I actually am employed, is because things happen. That's the realistic answer. But I can help you find it early by you listening to us, by you listening to your body, by you getting to know yourself, but by also being calm. Okay? Okay. A lot of flurry in this garage right now because it's pouring rain and people are starting to get into the office. I'm going to go get things done on this crazy Monday morning. I hope you all have a great week. I will see you more this week. On Wednesday, I'm doing an IG Live with Wendy McDonald, who's an amazing OBGYN. Her Instagram is fantabulous, very creative. And we're going to be talking about inequity in ovarian cancer and the diversity data with a lot of disparity that occurs in the African American Black population, but also in many minorities, but specifically Black women, unfortunately, get diagnosed at later stages, and their biomarkers are not necessarily able to be interpreted the same way white women. So once again, it is something that Black women really need to understand and know, unfortunately, and the medical community needs to understand because we don't do that well. Okay, have a good week. Goodbye.